Good morning and welcome to Heal with Grace, hosted in partnership with the Grace Holland Cozine Foundation. I'm Jessica Hickman Cicero, the Director of Community Engagement at the National Eating Disorders Association. Before we get started with our program, I'd like to remind everyone that if you're viewing the program from a mobile device, such as a cell phone or a tablet, please use headphones for optimal sound quality throughout the duration of the event. Thank you. It's an honor to be here today, surrounded by so many strong and passionate advocates. Today, we have gathered online to honor the loved ones we've lost to eating disorders. And together, we will find strength in community and heal our hearts with grace. NEDA envisions a world without eating disorders, a world where education, prevention programs, and quality care are accessible to all. A world where no more lives are lost to these devastating illnesses. Unfortunately, this is not yet our reality. Eating disorders are deadly diseases that have extinguished too many bright lights. But even in the darkness, there is still hope. Over 250 people joined our Heal with Grace community. Each person here knows the heartache of loss, but each person here knows how to fight hard for someone they love. Each person here has experienced the hardest of days, but still believes in a brighter tomorrow. And when 250 people come together under these particular circumstances, it is undeniable proof of hope and the healing power of community. Today's program will include conversations on loss, hope, and healing. We recognize this event will bring many emotions, so we would like to invite you to participate in a guided meditation with Elisa Saki-Lyon. Elisa is a registered nurse, yoga teacher, and embodiment coach. She guides her students through an accessible journey of mindful movement, self-awareness, and gratitude that harmonizes the flow of the body, mind, and soul. Using her lived experiences, Elisa raises awareness for mental health and eating disorders in people of color and marginalized communities. Welcome, Elisa.
Hi, everyone. Thank you so much for that warm introduction and for that beautiful introduction to this event. As a person who has also recovered or in recovery, this event is very, very special to me, and I'm very honored to guide you all in a grounding meditation. So when you're all ready, go ahead and find a comfortable position. You could be seated, you could be laying down, you could be on the ground cross-legged, whatever feels safe and comfortable for you. And if it feels safe for you, you can gently close your eyes, allow your eyelids to fall, or gaze down. And then we'll take a moment to take 3 deep cleansing breaths. So inhaling nice and deep through the nose, gathering that breath, filling up the lungs. And then with your mouth open, exhale all of that out. Again, one more time, breathing in through the nose, feeling the breath enter the nostrils, the throat, lungs, filling up the belly. And then exhale with the mouth open, letting all of that stagnant energy go. And the last one, take a nice, deep, slow breath. Again, in through the nose, cleansing, nourishing, purifying your body. And then with an exhale, allowing your breath to invite more relaxation and release of tension, melting down into your chair or whatever surface you're sitting on. And then just take a moment to notice whatever is touching the surface beneath you. Maybe it's those sit bones on your chair. And imagine as if there are roots, like a tree, growing down into the earth, giving you guidance and a strong foundation and strength and courage. And then I invite you to give yourself permission to be 10% more relaxed as you tap into that breath. I invite you to take one hand over your chest and then another hand right on top of your belly button, making that mind, body, spirit connection. And just notice that breath. And find where it's most prominent for you. Maybe it's the inhale in through the nose, that cool air coming in. Or maybe it's the rise and fall of the belly and the chest. Or perhaps it's this whole body sensation as your whole body takes up a few centimeters of space. Wherever it is, just notice and remember that your breath is your anchor. It is that sign of life and vitality, and it is always there for you. So if at any time during this event you feel the need to find groundedness, come back to your breath. And then as we all together as a collective sit here in groundedness, just take a moment of silence to honor all of the angels and warriors who have passed due to an eating disorder. And together taking a nice deep breath and giving gratitude for that breath. And then exhaling all of that air out, sending healing and grace to everyone of this earth, especially those who have been affected by someone who has lost a person or individual of an eating disorder. And giving honor and gratitude for the Cozine family and for NEDA for this powerful event. Now when you're ready, gently bring life back into your fingers and your toes. Bring breath back into your body and gently fluttering your eyes open to be present for the rest of the event.
Thank you, Elisa, for that very grounding exercise. And as Elisa mentioned, if at any moment during this program you need to pause, we encourage you to go back to that breath. Thank you, Elisa, for helping us honor all of the lives we've lost to eating disorders today. Thank you.
Thank you.
As you may know, Heal with Grace was founded in loving memory of Grace Holland Cozine. Grace was a fierce advocate who always emphasized the lack of education about eating disorders in schools. She recognized that despite being an illness that affects so many individuals and their families, eating disorders aren't often talked about, and they tend to hide in the shadows, making it hard for people to understand. The Cozine family has set out to change that by establishing the Grace Holland Cozine Foundation and partnering with NEDA to bring education and prevention programming to schools. At this time, we would like to welcome a special message from the Cozine family.
Hi, we're the Cozine family, and we just want to express our gratitude for everyone joining today in this important program, Heal with Grace.
Today we will talk about loss, but we will also talk about hope. More than ever, there is a need for advocacy, education, and community. It is our hope to join forces with the appropriate resources for those at risk and those in need.
Just want to say a few words about Gracie. Grace was truly a beautiful girl, inside and out. She had a magnetic personality and lit up every room she ever walked into. Grace was smart, funny, compassionate, direct, loyal, and incredibly empathetic. The adjective we use for Grace so often is fierce. Grace was fierce not only in fighting her own eating disorder, but also in supporting and advocating for others. She understood the need to shine a light on it and had the courage to share her story in therapy and blogs whenever she possibly could in order to support others and help defeat this terrible disease.
We've established the Grace Holland Cozine Foundation, which allows us to honor her memory and work with NEDA and other organizations on programs like the Body Project, which brings important education and awareness to at-risk students in high school. Grace often spoke about the need to talk more openly and constructively about eating disorders in school, and the Body Project offers just that. We're so proud to have partnered with Rhinebeck High School and Great Neck High School and look forward to engaging with more in the coming year. During this time of COVID, where there is more isolation, the importance of these types of programs becomes paramount. There is a need more than ever to continue this outreach, and we are working with NEDA via the Body Project on ways to offer more support virtually, so stay tuned for updates there.
Thanks again to everyone who has participated and contributed to this important event. As we come together to heal with grace, it is so important for us to continue to engage and help those who are affected by this complicated disease. Reach out, advocate, contribute, volunteer whenever possible. Together we can truly make a difference. I'll leave you with Grace's words as a reminder to all of us, especially during this trying time. Life is meant to be lived, not restricted.
Thank you, Patty, Dan, Biz, and Sophie. Thank you for bravely sharing Grace's story and spirit, for inspiring hope, and for sharing how we can all truly make a difference. And thank you to everyone who is here today and to everyone who has contributed to this event. By supporting Heal with Grace, you have already made a big difference. I'm honored to announce that together we have raised over $55,000 to support NEDA's prevention, education, and support programs, as well as critical research and advocacy initiatives. Thank you so much for your support. Here to share more about your impact is NEDA's Chief Development Officer, Chris Novak-Mika. Hi, Chris, welcome.
Thanks, Jessica. Good morning, everyone. We are just so grateful and thankful to all of you for sharing with us today in our commemoration of hope, of healing, and of grace. Together with your support at NEDA, hope is delivered through a variety of program impact that we're able to serve the community with. NEDA's online screening tool can detect eating disorders early and guide people to the first steps of recovery. Our free helpline can answer the calls of people at their time of need and connect them to recovery resources. Education, which is so critically important in engaging parents, educators, and coaches with toolkits to equip their support systems, and also awareness efforts through weeks like NEDA Awareness Week. Our advocacy and research to improve treatment outcomes and eliminate barriers to care. You'll hear more about these critical pieces of our work later on in the program. And finally, last but certainly not least, is our prevention programming, including Confident Body, Confident Child, and the Body Project, both evidence-based programs proven to reduce the risk of eating disorders. At this time, I'd like to welcome Rachel Curran to share more about the work she is doing to reduce the onset of eating disorders in her community through the Body Project. Rachel is a school counselor at Hopewell Valley Central High School in Pennington, New Jersey, and an adjunct professor of applied psychology at New York University. Rachel's proud to be a trainer and facilitator for the Body Project and is passionate about early interventions and prevention programming for students. Welcome, Rachel.
Thank you. My name is Rachel Curran. Thank you to the National Eating Disorders Association and the Cozine family for allowing me the honor of speaking today. I'm currently in my 10th year as a high school counselor, and over the years, I have worked with students battling eating disorders and provided support for them and their families, while also being an advocate through their recovery journey. I have run peer groups for my students, and all too often the topic of body dissatisfaction emerged, where they expressed pressures to conform to an appearance ideal. These pressures were all around them: peers, families, social media, and the list goes on and on. I always felt like I needed to do more. I wanted to be able to support my students by providing early interventions and prevention programming. 2019 marked an important year for me. It marked my 10th year in recovery from an eating disorder, and it was the year that I discovered the Body Project. The Body Project is a group-based intervention that provides a forum for high school girls to confront unrealistic appearance ideals and develop healthy body image and self-esteem. It has repeatedly been shown to effectively reduce body dissatisfaction, negative mood, unhealthy dieting, and disordered eating. There is further evidence that the Body Project reduces the risk of future onset of eating disorders and obesity. This manualized intervention consists of written, verbal, and behavioral exercises in which participants voluntarily critique our culturally promoted appearance ideal for women. So, after a life-changing day in New York City attending the Body Project Facilitator training, I knew this program was exactly what I was looking for. Even in the face of a pandemic, when schools around the globe went virtual, so did the Body Project. Students were stressed, overwhelmed, were experiencing a sense of loss and grief, and they were spending so much time on social media and on virtual learning platforms. And many teachers and staff were reporting students struggling to turn on those cameras. For some of my students, this experience is only exacerbating their body dissatisfaction. So, in an effort to respond to the needs of my students, and in collaboration with Jen Carroll and the National Eating Disorders Association, the Body Project went virtual. My girls were dedicated and passionate about the program. In fact, in my many years of providing group interventions, I have never seen more dedication to a program. As we closed out our virtual Body Project experience, I am happy to say that every one of them expressed that this program had a positive impact on their life. Their confidence and body image had improved. The program affected their notion of societal appearance and beauty ideals, and they had started applying some of the lessons from the Body Project into their everyday lives, while also being dedicated to acts of body activism. This school year, I am very excited to continue the Body Project experience and journey with my students. And now as a Body Project trainer, I hope to be able to expand this program beyond my school districts and into other local communities as well. So today, as we are here to honor those we have lost, I hope that the Body Project can be a source of hope as I continue to heal with grace. I hope that my work with the Body Project may prevent others from ever having to heal at all. Thank you.
Thank you, Rachel, and thank you, Chris. And thank you again to everyone here today for moving our shared mission forward. The next part of our program is about hope, strength, and healing. We have a special musical performance by Sophie Cozine. This performance is dedicated to all of the loved ones we've lost to eating disorders.
Hi everyone, welcome to Heal with Grace. I'm Sophie, I'm Grace's sister, and today we're going to be performing a song that I started writing with Grace for my dad, and it's just become a song about her, so please enjoy Into the Blue. Can't imagine a world without you. If you left, I'd be bruised, black and blue. Irreplaceable you are to me. I'd be lost without your company. Time is passing as fast as ever. When I'm dreaming, we're still together. I hear your voice on every harmony. It's the note that leads you back to me. Scared, but I'm trying. And I know we're young, and I know we're scared. I'm still trying. And I know we're young, and I know we're scared, but I'm trying. And I know we're young, and I know we're scared, but I'm trying. Into the blue. That's where you find me. And I'll find you too. Never be a world without you. Now everything has turned to yellow. Irreplaceable you are to me. I'll never be without your company. I know we're young and I know we're scared, but I'm trying. And I know we're young and I know we're scared, I'm still trying. And I know we're young and I know we're scared, but I'm trying. And I know we're young and I know we're scared, but I'm trying. Try, 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 trying.
Thank you, Sophie and company, for that beautiful and heartwarming performance. That was really special. I would now like to introduce our first keynote speaker, Eileen V. Fishman. Eileen has maintained a general psychotherapy practice with a specialization in the treatment of eating disorders for 36 years in both Montclair, New Jersey and New York City. Eileen helped found the National Eating Disorders Association and currently serves on its executive board of directors and as a clinical advisor. Welcome, Eileen.
Thank you, Jessica. Hello, everyone. I am so moved by the Cozine family. That was a beautiful, beautiful video that you did. And Sophie, that was just beautiful, the performance. The tribute to Grace is just incredible. And we are so grateful to you for inspiring all of us to rise to loss and suffering. We have known at NEDA for a very long time about, as much as we try to support people to get well and we support people struggling through eating disorders, we know that people are lost to eating disorders. And we have always tried and been committed to supporting those who have lost loved ones. As far back as I can remember it, the annual NEDA conference, which we used to have, we always had a loss support network, a loss support group. And for many years, I ran that group. And I would see family members, I would see parents, I would see siblings, I would see loved ones, I would see children who lost parents. And we have always, again, known how very, very important it is to help people and support people through this very unique loss, right? Going through an eating disorder is a unique challenge, and losing someone to an eating disorder is another level of unique challenge and pain and suffering. We're also and I'm just really, really grateful that this is the inaugural event, that what you're doing with Heal with Grace will continue to go on, because we know that pain and suffering is not time limited. When there is a loss, I think that people often tell you to, or expect you, or hope that you'll just sort of move through this more quickly. When you continue to suffer or feel bad, you know, sometimes there's a feeling of, well, why aren't you getting better faster? Or why aren't you feeling better faster? Or why aren't you healing more? Or hasn't it been a long enough time already for you to be past this? And the answer is, there is no time limit on this kind of pain and suffering. It is so much of an ongoing process. And the fact that we can have Heal with Grace and we can offer this to other people, whether it's the beginning at the moment of loss or around the time where it's an early point in the journey of loss, or whether it's at any point during that journey, and that can be years into the loss experience, it is very, very much an ongoing process. And something that I want to share with everyone today, a couple of thoughts I have. One is, I think that what the Cozine family is doing, what you're doing is really role modeling for all of us how to rise to pain and suffering, how to rise to that challenge, right? We don't get to choose what happens to us in life. Certainly what you're going through it's an impossible loss for some of us to imagine, or some of us know that loss. But to be able to rise, to be able to do something good, to suffer productively, to figure out what you can do to help yourselves, to honor the person that you love, that you've lost, and to help others is incredibly inspiring and incredibly important. And one of the things that we all have to do with loss and pain and suffering. The other thing that I really want to support people in doing is feel your pain fully. Don't be afraid to feel your pain. You know, we're taught in life to get past things quickly, to not be too self-indulgent. But really, the way to get through pain and loss is to feel it fully. And the more fully that we productively suffer, the more fully, rather than avoiding that pain or trying to repress that pain, which is far more dangerous for all of us in terms of other symptomatology or other problems, it's much, much healthier to feel your pain fully and to move through that pain respectfully, and really respectfully honoring your pain and suffering, and honoring the process, and honoring the journey, as arduous as it is, as repetitive as it might be. And again, you may feel like you're over it, or other people should think that you're over it, and you must always respect the fact that there is no getting over it. We don't get over this kind of loss. We live with it. We try to make peace with it. We try to find the right kind of support as we need it, and we try to do something positive with it so that we can help others and we can honor the loved one that we've lost. So I support all of you in your journey with pain and suffering. NEDA is always here to help you. We get it. We know that this is real, that this is important, and we are always here at any point. Please reach out to us for help and support. And thank you once again to the Cozine family. I am so impressed with all of you and so moved by what you're doing for the community, how you're rising to your pain and suffering, and how you're honoring dear Grace. So thank you so much. Thank you all.
Thank you, Eileen, for that very powerful, insightful message and for all of your contributions to the eating disorders field. We're very grateful to have you with us today.
Thank you.
Our next speaker talking about finding hope after loss is Kendall Baker. Since losing her best friend to an eating disorder in 2018, Kendall has been devoted to advocacy and raising awareness for eating disorders. She maintains her own blog at kendallbaker.com, focusing primarily on grief, eating disorders, and mental health. Kendall hopes to soon pursue a master's in social work so she can work with people struggling with eating disorders in a clinical setting. Welcome, Kendall.
Hi, thank you so much for having me today. It's an honor to be here with all of you. So like Jessica said, my name is Kendall Baker. Tomorrow will mark 2 years since I lost a very dear friend of mine to anorexia. Her name was Katie. In these last 2 years, I've learned many things about grief, specifically grieving a loved one that lost their life to an eating disorder. A lot of those things have really come as a surprise to me. The first thing is how confusing grief can be. Before Katie passed away, I had lost 2 of my grandparents and 1 close friend from high school who died of a brain tumor. I loved my grandparents and I was very close with them. And though their deaths were not welcome at 85, they weren't surprising either. My high school friend who passed away from a brain tumor hit me differently. She was 21 when she died, and it really just didn't seem fair. She was in nursing school, engaged to a man she loved, and really just getting started with her life, and then she was gone. That was harder to come to terms with. People rallied around her friends and family, though. There was an outpouring of love and support. People called her a hero, and I believe she is, for choosing to donate her body to science after her death so that hopefully one day doctors could find a cure for the inoperable tumor that took her life. When my best friend Katie died as a direct result of anorexia, though, the grief was more complicated. As Eileen touched on, losing someone to an eating disorder is a complicated loss. It was confusing. It was lonelier than any other time I've experienced grief. I believe after thinking about it a lot, excuse me, that her death and the grief that followed were more complicated and confusing for a couple reasons. First, Katie and I had been close friends for 10 years, even roommates at one point. We lived together, worked at the same job together. We were literally never apart for at least a year during that time. We shared a bedroom because I was the 4th roommate in a 3-bedroom apartment. I felt like I knew her as well as any human being could know another. I knew her, I loved her, and I still couldn't save her. I tried everything I could think of, but she had gotten so sick and I couldn't love her out of her illness as much as I wanted to. That was the most useless I've ever felt. Watching her die in front of me and not being able to do a thing to stop it. Secondly, eating disorders are hard to understand both in life and in death. I've struggled with an eating disorder myself and I'm now 9 years recovered. And because I've been there, I feel like I should fully understand eating disorders and I should have known how to help Katie, but I didn't. And I still fall painfully short of a comprehensive understanding of the illness that, took my best friend's life. Which is difficult to understand. In my grief following Katie's death, things got confusing. I realized the person whose hospital bed I'd sat beside just 2 days before she died wasn't really my Katie. When I think of Katie, I remember her and grieve for her. I see her healthy in my mind. I see us having fun, her bright, beautiful smile. Something I haven't shared in the articles or in my blog is that sometimes when I was visiting Katie in the hospital before she died, it seemed like she didn't want me there. It would shift back and forth. She'd beg for me to come, say she needed me there, and then I'd come, and she'd often seem uninterested in me being there. Not all the time. Even towards the very end, glimpses of the Katie I remember would pop up now and then. But it did further confuse me. Unfortunately, manipulation, lying, secretiveness, and even sometimes taking advantage of other people are hallmarks of an eating disorder. All those traits I just listed are the complete opposite of Katie's character, but they do come through in varying extents in any eating disorder I've ever witnessed. I realized that I had started grieving Katie shortly before she died because we knew it was coming, and I actually have no idea exactly when I lost the friend that I knew. That bothers me. It bothers me that I can't identify the moment she slipped away and didn't return, and it bothers me that obviously I didn't notice at the time. For me, it helps to separate Katie's eating disorder from Katie, the Katie that I knew. Those negative traits that were showing more and more as the eating disorder took over from who I know her to be as a person. All her beautiful, positive attributes, like they said about Grace in the video, how she was so encouraging and supportive to everyone, even while fighting her own battle. That was so Katie. And I think a lot of people that experiences eating disorders have a great deal of empathy, and that was Katie as well. So it's helpful for me to separate out Katie's illness from who Katie really was. Losing a loved one to an eating disorder or any mental illness isn't something I'd wish on anyone. Navigating that kind of unique grief is tricky. I don't think I'll ever get over losing Katie, but 2 years later, I've started to move on with my life one step at a time. Right after Katie died and in the months that followed, I actually felt guilty talking about anything else but Katie. I felt guilty if I was happy. I missed her so much, and if I wasn't in the space of heartache, I felt like I was doing something wrong. Just beginning to move on took months. What helped me was remembering that Katie is more alive now than she had been in years. She's no longer suffering. She was suffering so much in the last weeks and months of her life, and she is now free from the clutches of her eating disorder. Katie is at peace and she's okay now. And I know she'd want the same for me. I know she wouldn't want me to be stuck in that messy grief forever. I can picture her in my mind saying to me, I'm okay, I'm happy now, and you can be happy too. All that grief needs someplace to go. For me, I pour it into advocacy. Advocacy and spreading Katie's story, which she asked me to share right before she died, have been the biggest part of my healing. Even in advocacy, though, I sometimes struggle with never feeling like I'm doing enough. I suppose deep down it's not enough because it doesn't bring Katie back, so it'll never be enough. 2 days before Katie died, though, she asked me to share her story to help other people. She said that even if it just helped one other person, that it would be worth it. So that's what I try to do. It's comforting to be able to honor Katie by doing what she felt was most important, helping others. I'll never stop missing her, and I'll carry her with me for the rest of my life. Let me be very clear, this is a blessing, not a curse. Katie's spirit is light and full of love. She is not a sad or heavy burden. Knowing her and being her friend made me a better person and set me on a new path I would have never discovered otherwise. And if I have a message for anyone else out there missing someone who's been gone for a while now, long enough that they think they should be over it, it is this. You never get over the loss of someone who deeply touched your heart and changed your life, nor should you. You carry them with you and you do your best to find the happiness that they always knew you deserved. Try to think from their perspective when you're struggling. And I'm speaking right to myself here too. But I still don't know why, but Katie believed that I and all those she loved deserved every happiness life had to offer. So when it's hard for me to believe that, I try to switch to her perspective. I know her well enough to predict what she might say to me, and I try to listen to that message over the conflicting and doubtful messages I sometimes tell myself.
Thank you so much, Kendall. Thank you for bravely sharing Katie's story and for sharing how you've learned to find strength in hope and healing and advocacy. I can say for sure that Katie's story has touched well beyond one person and that it's touched every single person here at this event. Thank you, Kendall.
Thank you.
Thank you again, Kendall, and thank you, Eileen, for those messages of hope, strength, and healing. A common theme that brought us together today is the yearn for a better tomorrow. NEDA believes that through research and advocacy, we can build a brighter future for the field of eating disorders, and we would like to share some of our work and aspirations with you. Here to share how far we've come and where we're going is eating disorders expert Heather Hauer. Heather is an executive board member of NEDA and a faculty associate specialist at the UCSD's Eating Disorders Center for Treatment and Research. She serves in various capacities for the Academy for Eating Disorders, the International Association for Eating Disorder Professionals, the Department of Defense, and more. Heather's current research interests include exploring eating disorders traits as strengths, promoting temperament-based treatments, and defining recovery. Welcome, Heather.
Thank you. Thank you for having me. And thank you all for joining me for Heal with Grace, a virtual event honoring those that we've lost to eating disorders. A special thanks to the Cozine family who have founded this in loving memory of their daughter, Grace Holland Cozine. There are no words to adequately express the loss one feels when a loved one is taken from us, whether it's sudden or over the course of time. We wish, though, that today will be a day of healing and connection that will inspire hope. My name is Heather Hauer, and I serve on the board of the National Eating Disorders Association, including as a Research Advisory Council member for Feeding Hope Fund. I'm also a faculty research associate at Brown University School of Public Health and a faculty associate specialist at the University of California in San Diego School of Medicine. I have 25 years of experience as a researcher, and I also have 23 years of lived experience with anorexia nervosa. I often feel as if I'm wearing two hats, though one does influence the other. While at times it can feel frustrating that we haven't found a cure for eating disorders yet, we've actually come a long field from the old myths that we used to believe, which were barriers to diagnosis and care. We now know, thanks in part to research, that the truths about eating include that eating disorders affect people of all genders, ages, races, ethnicities, body shapes and weights, sexual orientations, and socioeconomic status. Eating disorders are not life sentences, but seriously biological illnesses. Genes and environment play important roles in the development of eating disorders. Genes alone do not predict who will develop eating disorders. Families are not to blame and can be the patient's and provider's best allies in treatment. And full recovery from an eating disorder is possible with early detection and intervention, very important aspects. On this last truth, I'm an example of someone who had an eating disorder for decades and was able to make a full recovery. This is due in part to my motivation to gain sanity and reclaim my quality of life, but also to research that has revealed the underlying neurobiology of eating disorders, which explains in part the thoughts and behaviors I have that are different from others. This knowledge has increased understanding and empathy for my loved ones who are able to take a walk in my shoes and see how the eating disorder is separate from the essential me. There are several areas of emerging research that provide hope for the future, including how temperamental traits, for example, perfectionism, onset before the eating disorder and persist after recovery, can be utilized as strengths which contribute to success in life areas. New advances in genetics, including genome-wide association studies such as the Anorexia Nervosa Genetics Initiative, or ANGI, and the Eating Disorder Genetics Initiative, EGI, have the promise to identify genetic markers that are associated with the origins of eating disorders. These findings can in turn suggest future treatments such as psychotherapy and or medications. Part of NEDA's mission is to advocate for increased research funding for eating disorders, which pales in comparison to other major medical and psychiatric disorders. Since 2013, NEDA's Feeding Hope Fund for Clinical Research has awarded $1.5 million in research grants, which aims to support projects that will improve the lives of individuals affected by eating disorders. And this year, we're excited to announce funding for the continuation of 2 research projects that we originally supported in 2014 and 2017. These projects will help to disseminate eating disorder treatment training videos virtually, which will be applicable in COVID-19 and beyond, and evaluate barriers to treatment access, which can provide data to inform advocacy. Through our loss and pain, we will find strength to create to build a brighter future. With your help, we can honor the lives of those we've lost to eating disorders by raising funds which will support prevention, education, resources, advocacy, and critical research. Once again, thank you for joining us today. Thank you for your courage and persistence through your loss. And thank you for being part of a community that is working to build a brighter future so that no more lives are lost to eating disorders. Thank you.
Thank you so much, Heather, for being here today and for giving us a glimpse into that hope and for your many contributions to our field.
You're welcome.
And before we move on to our final speaker, we would like to share a special video message from past Feeding Hope Fund research grant recipients.
With the generous support of the Feeding Hope Fund, we at Columbia were able to conduct a study to look at whether having the support of a peer mentor, so someone who has been through and recovered from an eating disorder, is helpful for adolescents and adults who are currently seeking to recover. The findings of this study showed that the group who worked with a peer mentor had greater decreases in body dissatisfaction, anxiety, and depression compared to participants in the other 2 groups. And they also tended to report greater decreases in the frequency of behaviors like restriction, purging, and binge eating over the course of the program. One reason that these findings are so important is because many patients with eating disorders can't or don't receive formal treatment, and so understanding if peer mentorship is an effective alternative is critical.
My colleagues and I have been very fortunate to receive a grant through the NEDA Feeding Hope Fund to find ways to prevent eating disorders in the many people who are at risk. A number of studies have shown that programs can be effective in reducing risk, but the most effective programs require some moderation. In order to scale these programs to a level that they can be available to the many hundreds of thousands of people who would benefit from them, we have to find ways to make moderation cost effective. The study has gone very well. We wanted to recruit 700 women into the study, which we have done, and we're now conducting the 6-month follow-up to see if the program is as effective as we hope it is. Thank you very much. This is an area dear to my heart and I think will be very beneficial to so many people.
In 2014, we received a Feeding Hope Fund grant that allowed us to develop a new approach for treating anorexia nervosa that specifically targeted habits. With the help of the Feeding Hope Fund grant, we compared this treatment with a different psychotherapy, and we found that targeting habits in this way helped patients be less habit-driven, reduce their eating disorder symptoms, and help them eat better. The Feeding Hope Fund was necessary for us to translate the neuroscience of anorexia nervosa into a new and useful treatment approach to help patients with this disorder. We're grateful to have had the support of NEDA, and we are now working on the next steps for developing REACH, which we hope will improve the lives of patients. Thanks, NEDA.
This research allowed me to examine the feasibility and acceptability of appetite awareness training to prevent binge eating disorder among Black women in primary care. This research also just helped provide a strong foundation for my research program to develop interventions to treat eating disorders among African American women. And I am so grateful. I have been just so energized by what I have been seeing in my research, what I've been hearing from my participants, and what we are learning about how we can help Black women learn how to support themselves in their eating, how to understand the impact of health disparities such as food insecurity and poverty, and how we can better just develop research questions and interventions to address the social justice nature of eating disorders. And so I am grateful to be part of this community, and I thank you and support you for what you are doing to help others overcome their eating disorders and to grow and be healthy.
In 2013, we were awarded the National Eating Disorder Association Feeding Hope grant. This grant allowed us to investigate the delivery of family-based treatment over telemedicine. Throughout the 2 years of our study, we were able to understand ways that we could continue to develop and deliver family-based treatment using the video platform and meet the needs of families that were not able to access treatment due to living in underserved or rural areas. We are very grateful to the National Eating Disorder Association for their support of our research and many, many other research projects through this Feeding Hope Fund.
Through NEDA's Feeding Hope Fund, their grant program, my colleagues Laura Hill, Stephanie Peck, Walter Kay, and I were able to develop and test a new treatment for adults with anorexia nervosa. TVTS is designed to fill the biological gaps in current treatments. Results of our open trials are promising with good outcomes. And as a result, several countries, including Australia, Norway, Canada, Greece, and Argentina, are now implementing and testing the treatment.
We're so grateful for the funding we received from the NEDA Feeding Hope Fund. One way of enhancing our current treatments is through the use of virtual reality. Our study findings showed that we could successfully train U.S. therapists to deliver the virtual reality Q exposure therapy and that they were eager to do so. And that in just 8 sessions, most of our clients were able to reduce or completely stop their binging and purging behaviors. We're really thankful for the opportunity to use funding such as that came from NEDA to develop more innovative treatments so that we can help more people get better and respond more quickly.
Our final speaker for today's program is NEDA's Public Policy Manager, Carrie Donahue, who will share how we are building a brighter future through legislative advocacy. Please welcome Carrie. Good morning.
Thank you, Jessica. Hi, everyone. As Jessica said, I'm Carrie Donahue, the Public Policy Manager at NEDA. And I first want to thank all of the speakers who have spoken already today. It's been a really powerful event, and it's an honor to be here with you today to help honor the lives of those we've lost to eating disorders. As Jessica has also said, at NEDA, we believe in a brighter future for the field of eating disorders. And part of our mission is to serve as a catalyst for prevention, cures, and access to quality care so that no more lives are lost to eating disorders. So today I want to talk to you about some of NEDA's policy efforts that we hope will bring us closer to our vision of a world without eating disorders. Through NEDA's advocacy program, we work with volunteer advocates like you to share stories and educate lawmakers to raise awareness about eating disorders, with the goal of changing laws at both the state and federal level related to eating disorders research, prevention, and access to care. And I want to talk specifically about 2 initiatives that we focused on this year related to eating disorders research and prevention, and about how you might be able to get involved in helping us support these initiatives. So first, we've been working to build support in Congress this year for legislation called the Eating Disorders Prevention in Schools Act, which would encourage schools to include eating disorders prevention within their local school wellness policies. These policies guide school districts to create supportive school nutrition and physical activity environments. The Eating Disorders Prevention in Schools Act would ensure that these policies include adequate guidelines about eating disorders prevention to help prevent eating disorders and to improve the overall health outcomes of all students. We're also working with Congress to encourage the National Institutes of Health, or NIH, to increase its funding dedicated to eating disorders research. We know that these initiatives could have a lasting impact on our field, and we cannot do this work without advocates who are willing to share their stories to help make a difference in this fight against eating disorders. Constituent stories are so important in the work that we do to educate lawmakers, probably the most important and impactful thing that we can bring when we're educating our lawmakers. Our lawmakers need to hear your stories. They need to know about the devastating impacts of these illnesses so that they can work with us to build a brighter future together. So I'd like to encourage all of you to take action with us today. I know that most of us have our cell phones on us most of the time, so I'm hoping that's the case this morning. And I'd like to encourage all of you to take out your cell phones right now. And you can text NEDA now, as you see on the screen here. That's NEDA now to 52886. Once you send that text message, you'll be sent a link back to your cell phone. You can just click that link right there, and it will bring you to NEDA's advocacy page, where you can fill in your information, and you'll be joining, by filling out your information there, you'll be joining NEDA's community advocates. And as part of this community, you'll receive regular updates on our policy initiatives and about how you can participate in making your voice heard. We want you to remember that your experience matters and your voice deserves to be heard. And I just also want to say that just by joining today's event, you are already eating disorders advocates. You're helping us raise awareness, and that's so important. And so thank you all for showing up today, and I'll hand it back to Jessica.
Thank you so much, Carrie. Thank you for giving us the tools to take action to make a difference right here and right now.
Thank you.
And I want to thank just Carrie and Heather again for giving us a look into a brighter future for the field of eating disorders. We would like to close today's program with a special tribute honoring all of the loved ones we've lost to eating disorders. Thank you to the many families who submitted tributes and messages of hope. And thank you to the Cozine family and friends and the Grace Holland Cozine Foundation. This is Grace's Butterfly Garden. Thank you again for joining us for Heal with Grace. Please remember that you are not alone. NEDA is here for you, and together we can build a brighter future. If you would like to learn more about NEDA and our work, you can visit us at nationaleatingdisorders.org. Thank you again.